And now it's time for The Doctor Is In.
Your genes may predict your risk of developing breast cancer. Dr. Lindsay Beakley, breast surgeon from Southern Cancer Center, is here to discuss what she's doing to help patients decrease their risk. Thank you, Dr. Beakley, for being here.
Thank you for having me.
And you recently received your genetic certification?
I did.
And talk to us, why is that so important for your patients?
Well, even though as a surgeon I'm speaking to patients about their surgical treatment options for breast cancer, I'm generally the first provider that they are seeing after receiving a diagnosis. So I like to take a comprehensive approach to their breast cancer diagnosis and talk about treatments and other factors like genetics that may play a role in their decision-making process.
I imagine that's a question you get quite often, is about genetics and the role that it does play in breast cancer.
I do.
And what role does it play?
So breast cancer genetic testing can have a role in what treatment options are available for a patient. They may make a surgical treatment decision based on their genetic testing results. And we're actually looking at not only their genetic susceptibility for breast cancer, but we actually screen them for other cancer genetic predispositions as well.
What are your options? Let's say you do test positive for a mutation. That's got to be, it's hard news to hear, but there are options available for your patients.
There certainly are, and so a lot of it depends on which mutation did you test positive for. Most people have heard about BRCA1 and 2, but there are currently 11 high-risk breast cancer genes that we test for. Now, their presentation or the risk that these genes are associated with might not be equivalent. So, for example, a BRCA1 mutation carries a higher risk for developing breast cancer than something like a RAD51. So we look at what gene you have and what treatment options are available. Sometimes it just boils down to you need high-risk screening. So not necessarily more aggressive surgical approach, but we watch you with MRI and mammogram more closely.
And this genetic counseling certification helps you decide and helps us pick our path, right?
Correct.
And those paths have changed, and there's lots of options for people. And just because you get one mutation, the treatment options are vast. And we're going to get into more of that, Dr. Beakley, in our Facebook Live post.
Excellent.